My name is John Method. I'm a pharmacist by profession, and also I work at the Pharmacy Council, the body that regulates the pharmacy practice in our country. And also, I'm an operations manager at Pharmlinks, a digital innovative platform that aims at revolutionizing the supply chain of pharmaceuticals in Tanzania. So today, I will speak on what is Pharmlinks, what we are doing in the health sector, especially in the pharmaceutical supply chain, because the pharmaceutical supply chain is a little different from the supply chain of other normal goods. Before I start, I'd like to share a simple but provocative question. How quickly would you make a decision if you had all your organization data integrated and analyzed in real time? The main aim of this question is for you to think on how important data is in organizations, especially in the health sector. And I would like you to think on how you can use the benefit of data in improving the quality of services that we provide in your health services. So, a supply chain is a network of activities, shareholders, and people who are involved in the manufacturing of pharmaceutical products, from the manufacturers all the way down to the patients who are consuming these medicines. And from this definition, one thing is very clear, that the pharmaceutical supply chain is a very complex one. And there are two reasons for this complexity in pharmaceutical supply chain. First is the high number of stakeholders that are involved in the supply chain of pharmaceuticals. There are manufacturers who are usually located in different countries, mostly in Europe and Asia. Also, there are importers who are then allowed to import only a certain amount of drugs into our countries. Also, there are wholesalers who are collecting everything and supplies them to the retailers, retail pharmacies, and also to the private facilities, dispensaries, and private laboratories. This complexity calls for very stable and a very efficient supply chain in pharmaceuticals in order to make sure that the community gets the medicines are available and accessible at affordable prices. The reason is that we know that pharmaceuticals are special kind of goods. They need special handling when moving from these different entities in order to make sure that the quality is not compromised, and to make sure that the people who need medicines get the medicines in right time and in right quality. So, as I described earlier, all this complexity in pharmaceutical chain, pharmaceutical supply chain, led to a lot of challenges in the market. The first one is large inventory. Always there's a constant increase in the generic medications and the brands that are registered and being sold in our market. So it is becoming very difficult to keep track of these new medicines and information, and it's even harder to retrieve them when the information is required. Also, there is demand variability in the market. We know that there is a difference between what we expect to happen in the market and what actually happens in the market. So diseases, they change. Some new diseases come in the community. Some of them erupt. So it is very important to have data that can predict and give us information on what is going to happen, let's say in 5 years or 10 years before it actually happens. Also, because of the nature of our market, it is operating in a very manual, and most of the documents are in hard copy. We have a lot of data which is not yet analyzed. And a data which is not analyzed is meaningless, because the goal is to change data into information and information into insight. So if you have a data but it's not analyzed, it's a burden which is not useful in the market. Also, Because of all this and the necessary activities that are happening during different steps in the supply chain, together with lack of transparency in the supply chain, the patients themselves face a challenge of high prices of medications, because maybe they don't know who has the best medicines and good medicines at affordable prices. So because of these challenges that are facing the pharmaceutical supply chain, we came up with Pharmlinks. Pharmlinks is a digital innovative health platform that seeks to improve the health of Tanzanian community by ensuring the supply of quality medications from the suppliers to the retailers. So in this complicated pharmaceutical supply chain, we chose to link and facilitate the movement of medicines from the suppliers to the retailers. And this is us, Pharmlinks. We are linking the suppliers of pharmaceutical products and the retailers or health facilities, private dispensaries, and so forth. This is our partners, COSTECH, the Commission for Science and Technology in our country. Last year they had a challenge called the Tuge Challenge, in which they support us with trainings and mentorship, and also they support us with funding to develop different products that we already have in the market. The first product that we have in the market right now is Pharmlinks as a service platform, which is a digital platform that enables the suppliers of pharmaceutical products to showcase what they have in their stocks online. So instead of a retailer of pharmaceutical products to move around from their premises to the city center looking for medications, first is moving from their premises to the supplier, and also it is moving from one supplier to another looking for the best prices, and also it is also difficult to get everything you need from one supplier. So it's always moving around collecting everything from different suppliers to make sure that you have everything you need. So with Pharmlinks, we have an Android application and a web-based application in which we recruit these suppliers, and they open virtual shops in our platforms, and then these virtual shops can be accessed by retail pharmacy owners, and by using their mobile phones, they can actually log into the account and see what supplier has which products at what prices, and themselves can compare which suppliers has the best medicines and which suppliers has the best prices, and actually make an order, and that order will be delivered to their doorsteps very quickly and in real time. You can see one of the interface of our application. It shows the picture of the products, the brand name, and other information pertaining that particular drug. Also, we have the Pharmlinks customized platforms. This happened when we were moving around recruiting the wholesale pharmacy owners, because some of them were having challenges already in keeping inventories of their products. So they give comments and opinions that we make customized platforms for their businesses. And this is one of those platforms in which he is having 250 clients who are making orders through the platform, and up to now, in September, he already had made more than 5,000 orders via the platform. I'd like to end my presentation with this quick survey that we did in partnership with Apotheca. We did a survey in Dar es Salaam, pharmacy owners, and the results were interesting. 73% of pharmacies, they reported to have facing challenges by the current method of procurement of medications. And 54% of them, they had an idea of an online commerce. They know what is online platform that you can make an order via an Android application in your phone, and you can actually have those goods delivered to you in real time. Also, 74% of those pharmacies, they had internet connection. Internet connection is a very important factor in working with the online platforms. So if 74% are having internet connection, it's actually very, very easy to work with the online platforms. Also, 90% of pharmacies were ready to use online platforms to make orders of the medications, such as Pharmlinks. This is very good insights, and this is what keeps us moving to make sure that we reach a larger percent of these pharmacy owners and ease the burden to the final consumer. Thank you very much. We have a booth out there. It's called Pharmlinks under Costec. If you want to reach to have more information, you are very welcome, and this is how you can reach us. Thank you very much.